Hello, everyone, and welcome to this audio podcast as part of this Traadax Fissure. This is a audio podcast. This is an audio podcast as part of a Traadax Rupture and Storm Robotics production, a chartered edition, an evidence-based perspective, and a Traadax Fissure. A Traadax Fissure Storm Robotics production as part of this an intermission. So in line to in line with sort of in line with World Kidney Day 2023. In line with World Kidney Day 2023. Um, in sort of looking at sort of works from almost over a decade ago as well, and sort of looking at works and looking at works looking at work sort of prospectively as well. This in this Traadax Fissure as in this Traadax Fissure sort of audio podcast, the overview or basis will be in and around looking back at the sort of seven strategies in around the lawmare of Bristol's blood and organ donation and sort of campaign that had taken place in 2000 in around 2014 and 15, but also in line with this, sort of highlighting sort of also putting a bit of a sort of an updated perspective on in around sort of a view on a view in around sort of transplantation as well, and also highlighting this sort of overview in line with sort of in line with this sort of a no, sort of a sort of a basis in around in and around in around sort of perspective works where where co- where from a collaborative perspective there will be sort of works taking place, sort of heightening aspects in around transplantation and awareness another perspective, and so as this sort of audio podcast as this audio podcast proceeds, there'll be a basis in around sort of there'll be sort of a perspective on some prospective collaborative works as well, and also aligned and also as part of this Traadax Fissure, to highlight that there is a a sort of a film premiere that will be taking place in around aspects of transplantation, colleagues and collaborators from the organisation, the British Islamic Medical Association, will are collaboratively um, are collaboratively putting together sort of a film premiere that's taking place in highlighting aspects around transplantation. So in this Traadax Fissure, that sort of audio podcast, there'll be a sort of a perspective in around this as well. So to begin with, sort of looking uh, uh, to begin with, in around sort of works that took place around the Lord Mayor of Bristol's blood and organ donation campaigns that are from almost over a decade ago, when this where this sort of works looked at, where this works and where this works, or at least the peer review publication, publication sort of from over a decade ago, looks at sort of blood and organ donation, in context of seven sort of campaign strategies. So it was in 2013, sort of originally a sort of a health awareness campaign commenced in the city of Bristol, in the city of Bristol, Southwest, United Kingdom, and involved sort of five sort of main influential organisations. The Lord Mayor of Bristol set out to highlight the importance of blood and organ donation amongst the ethnic minority communities and population, and where and wherein there have been um, sort of there have been a sort of a strive in around where in amongst the ethnic minority population, there have been sort of a lack of sort of awareness in some context, in and specifically in around the sciences and clinical practices that take place sort of the blood, in around blood and organ sort of in around blood and organ transplantation aspects, and so in part of this campaign and this works, or this initiative even, and that took place almost over a decade ago. The ultimately the sort of campaign aimed to increase the blood and organ donation sort of pooling context of Bristol's ethnic minority population. The peer review publication, publication sort of was had been the peer review publication and around this works have been published over a decade, where colleagues and collaborators sought to highlight sort of seven sort of strategies in around this, where the publication looks at sort of education, in around the education, the awareness and promotion, the sort of science behind sort of blood transfusion and transplantation, sort of the ethics aspects, the religious and cultural beliefs, looking at taking ownership and taking ownership aspects, and reporting and dissemination in around this, and the campaign sought to help raise awareness, and invited those from ethnic minority backgrounds and communities, to gain on awareness in around blood and organ donation and transplant, blood and organ sort of donation and transplantation, but also sort of gain but also sort of have a sort of heightened perspective in around the sort of important sort of an important sort of clinical sort of practices and the laboratory practices that sort of take place in for example in and around the work up of those recipients who are on who are on sort of a transplant waiting list, but also in the workup of in context of the serology around those who seek to, for example, donate blood and organs as well. So the objectives around this works sort of over a decade ago had been where following the publication of what was referred as an all parliamentary party kidney group, or APPKG, and National Kidney Federation NKF 2012 manifesto on improving sort of kidney donation in around transplantation, donation and transplantation amongst those in the ethnic minority communities, and also wherein the campaign aimed to sort of encourage those from ethnic minority populations, groups and populations, for example, to gain sort of an awareness around transplant organ donation, transplantation, organ donation and transplantation, registries in context in context in context of ensuring the sort of the will of individuals are known before, for example, passing away. So the campaign took place in collaboration with, for example, the Bristol Multi Faith Forum, the Renal Patient Support Group, the NHS Blood and Transplant, and two radio stations, Ujima Radio, in Bristol City, UK, and BCFM in the UK. And the main sort of objectives around this were to number one, to advise on issues relating to the cultural and sort of faith sort of aspects, publicize the campaign to those within BA black and in around ethnic minority around ethnic minority groups, and promote the campaign sort of using community leaders, or having community leaders involved, and develop a sort of a rollout on community a rollout of sort of community champions, and assist the community champion in assist community champions in undertaking particular and specific undertaking particular and specific sort of aspects of involvement, and also support sort of community events and forums in around discussions around transplantation, and aspects of for example for example, in around the clinical practices and sort of the sort of serology and pathology aspects around transplantation as well. So the peer review publication had been sort of a sort of a way really to highlight different sort of activities that took place through this sort of initiative, and this works sort of just over a decade ago, and at the same time the in around the peer review publication in around the peer review publication the the peer review publication again highlights seven sort of main campaign strategies, but also in amongst these particular campaign strategies, or these initiatives sort of strategies, again in around sort of education, awareness, and promotion the science behind blood transfusion, organ transplantation, ethics, religious and cultural beliefs, taking ownership and reporting and dissemination. The peer review publication from 2015 highlights sort of the sort of outcomes amongst these particular and specific seven campaign strategies. The peer review publication is available through the Renal Patient Support Group, the RPSG, sort of officially, and colleagues and collaborators amongst those who are involved also had for example, been involved to also see that those amongst colleagues and collaborators sort of involved had opportunities to cross collaborate in sort of relate in regard to in sort of in relating to similar works that had been taken place in around at the same time, at the same in particular in around this, just to sort of highlight some aspects in around, for example, the science behind transfusion and transplantation. Is to provide accessible to provide accessible literature in a variety of languages for service users in amongst sort of multi faith sort of communities, and amongst ethnic minority groups, and ethnic minority groups. And so in around this, scientists and clinicians also, so one of the aspects in around this peer review publication was where authors and collaborators informed that scientists and clinicians also need to interact better with the community, interact sort of better with the community, to provide a sort of more effective sort of a more effective sort of more effective sort of education, or healthcare education. And in around this, primarily, for example, the work of prospective transplants for recipients is through immunobiological assays to determine antibodies through recipients' human leukocyte antigen, or HLA system, and if a serum So for example, if a serum sample is tested against a panel of white cells from donors with a range of different HLA types, it is possible to identify the specificity of the antibodies from the reaction patterns with cells carrying different HLA types. It is important for those from the from it is important from those in those from ethnic minority ethnic minority populations, amongst sort of broader society, to understand the different concepts of science behind blood and organ transplantation. If there is to be, for example, an increase or increase of people, for example, making their will known in context of transplantation, or in context of blood and organ transplantation, before, for example, passing away. This then leads into an aspect that followed on, sort of in somewhat shortly after the peer review publication from 2015, wherein wherein a few colleagues and collaborators had looked at sort of putting had looked at developing sort of works wherein there would be an effort where sort of an effort in context of high sort of raising a sort of an sort of an understanding or a perspective in around the sort of the sort of challenges and dilemmas in around, for example, the opt-in versus opt-out system, or vice versa in context of transplantation. So in around some of this works, there there's that I'm gonna highlight. In part of this that I'm gonna highlight. There will be a bit of a highlight in around the arguments for transplantation, but also at the same time, this works will be looked at, will be sort of looked at again prospectively to actually put context in around this to develop another collaborative and hopefully peer review publication in around this as well. However, a little bit some basis a basis in around sort of the arguments and around transplantation, in around transplantation. So it was in 1959, corneal transplantation from deceased individuals was deemed permissible by the muftis of Tunisia and Egypt. And it was in 1979 the mufti of Egypt, in 1979 the mufti of Egypt at that time sanctioned both live and cadaveric donations. The grand ulama and scholars of Saudi authorized the permissibility of organ transplantation in around 1982. Then came the debate on the status of brainstem death. Eventually, International Islamic Jurists Council recognized it as a sign recognized it as a sign of death in 1986 in Amman and Jordan. The International Islamic Fiqh Academy, or IFA of Jeddah, issued a fatwa in support of organ donation in around 1990 and 2003, and provided it had been authorized by the deceased before death, and by by heirs after death, or with permission of concerned authorities, if the deceased had not been identified, or has no heirs in and no where a person again where a person where a person who has deceased had not been identified, or has heirs. In around the Muslim World League's Islamic Fiqh Council, the Fatwa Council of Malaysia and Singapore also permit live and cadaveric transplantation. The Fatwa Committee of Kuwait specifies that transplantation, organ donation, transplantation is forbidden if it prevents a donor from fulfilling normal obligations, such as by donation such as by the donation of a limb. Now, in around this works, the colleagues and collaborators from amongst the British Islamic Medical Association, from around 2000, around 2000 and around 2018, between 2018 and 2020, collaborators between the British Islamic Medical Association, and the Renal Patient Support Group, on the RPSG, had developed a collaborative initial collaborative works at that time, and works that that have just now have been highlighted is sort of initial perspective on initial sort of perspective on works of works initially developed. Now these works, I had other colleagues and collaborators from other organizations. However, part of this works also was further developed by the Renal Patient Support Group, the RPSG, in a standalone sort of peer review publication, looking at mainstream, looking at social media, mainstream media, in context of highlighting a transplantation, and looking at works from a sort of a scientist or a sort of perspective, and wherein this works wherein that particular works is highlighted in a audio podcast under the Storm Lobostics Productions, as a sort of standalone audio podcast, and so this works, or part of the works that have just been sort of highlighted, will be reviewed reviewed, and sort of prospectively there will be a sort of a sort of an F a sort of a sort of another a sort of a look at the work, sort of works again to develop sort of prospectively, again sort of looking at the looking at aspects in around the sort of for and against arguments, sort of the for and against arguments in around in around transplantation, but also in around sort of the sort of the backdrop or the specifics in around the sort of the sort of the sort of procedural aspects in around sort of transplantation as well. So there will be some there prospectively again sort of works in around sort of the opt-in versus opt-out sort of aspects in around transplantation. This now leads into now leading into in sort of it's not this now leading into sort of as part of perspective works as well, sort of collaboratively, colleagues from colleagues and collaborators between the between the in around some aspects in around some aspects in around the sort of in around those who have been in around those who've been sort of involved in from in around the sort of peer review publication from 2015, where for example one of the co-authors had unfortunately passed away shortly after the peer review publication and after the peer review publication from 2015, and where sort of retrospectively and sort of in sort of memory, if you like, from a collaborative from another sort of collaborative from another collaborative basis. There'll be sort of an effort to there'll be sort of another drive or an effort to look at the works sort of again, but at the same time to develop sort of some aspects of novelty in around the works, whereby in context of raising raising more aspects of awareness, there will be sort of collaborative works to look at sort of awareness by developing by developing works from a perspective of from arts, from sort of arts and performance in line with in align with awareness, in align with awareness, and where collaboration will be with colleagues with a colleagues from previous from a sort of a previous from a sort of a previous collaboration, from a previous collaboration or retrospective collaboration, but also aligned to works with the renal patient support group, the RPSG, and also with and aligned to the works under Storm Robotics Productions as well. And this now leads into sort of in line with sort of World Kidney Day 2023 as well. There is a sort of a film premiere taking place in around transplantation, in around transplantation in sort of in the coming day in the sort of coming days, and where the premiere, the film premiere looks at will look at sort of real life real stories in around transplantation, and where colleagues and collaborators representing the British Islamic Medical Association, sort of the British Islamic Medical Association and other organisations will be sort of hosting this sort of save a life, save a humanity film premiere set to take place, and where colleagues and collaborators sort of represent also represent an academic institution in the United Kingdom, to sort of transplant surgeons, and a pediatric intensivist from one of the sort of NHS trusts in the United in the Bristol in the southwest region in the United Kingdom, and also a nephrology sort of trainee, and also at this sort of a film premiere, at this film premiere that's set to take place in around Save a Life, Save Humanity. There will be a patient perspective as well. So in line to in sort of again in keeping in line to sort of World Kidney Day 2023, this overview sort of hopefully allows sort of listeners to get sort of get a grasp as to sort of the sort of activities that have been sort of taking place retrospectively, sort of taking place retrospectively, set to take place in sort of further collaborations, but also what are sort of and like to sort of activities that are also sort of also sort of taking place in sort of recent in sort of recent times in recent time in a recent aligned to a recent sort of a recent effort as well. So hopefully that would be in a sort of perspective audio podcast aligned to a Traadax Fissure, and another sort of audio podcast aligned to a Traadax Fissure and a Traadax Rupture. There will be a sort of an overview on an overview in around sort of these sort of works as well, and the again a future as part of this Traadax Fissure, this audio podcast, there will be some overviews in context of descriptives in on the social media and around this particular sort of Traadax Fissure intermission as well. So thank you for tuning in. Thank you for tuning in on this Traadax Fissure, this Traadax Rupture, this audio podcast aligned to this Chartered edition, this evidence-based perspective, this storm robotics, this particular this storm robotics production as well. And hopefully there will be another audio podcast to follow on from this one. Thank you.